ask the next speaker to come forward and tell us about exploring the viability of virtual reality for knee aspiration. Thank you very much.
Thank you. So, all right. Hi, my name is Mantaj Singh, or Taj if you like for short, and I'm a fourth-year medical student at the University of Adelaide. So today we'll be exploring the viability of virtual reality as a teaching method for knee aspirations. So I decided to declare that I've got nothing to declare, and I'd like to thank everyone who's contributed to this project. Okay, so a study found that 66.4% of GPs conducted their own injections. Most of them are minimally trained in the procedure. The emergency department also gives many referrals to the orthopedics department for septic joints. This delays diagnosis and then hence management. Being a relatively simple procedure, I think most of you would agree that doctors should be competent in doing the procedure by themselves, but also be adequately trained. So how do you get doctors to be more competent and comfortable with the procedure? Well, the best way to do so is to implement change at an institutional level and educate all upcoming doctors. So in this study, we built upon the work done in a previous study, looking at the best ways to teach knee aspirations. Sorry, the Zoom's just cut off there. I've got something on my screen. I'll just get rid of that. Is that all right?
Not seeing it up there.
Yeah, okay. So we taught arthrocentesis in both these studies as opposed to injections, as it allows students to get instant feedback of whether they're in the right location by aspirating fluid from knee models purchased by the University of Adelaide. So you might be asking, why are we doing virtual reality? Well, the simple answer is due to COVID-19, students have been displaced in the hospital and are lacking exposure and teaching to procedures that they would have previously gotten. So this led to questions of how to supplement teaching for these students and ensure they are the best quality. So this led to a virtual reality video being made with the collaboration with the University of Adelaide's Health Simulation Laboratory. In this video, students were able to watch a knee arthrocentesis being conducted in a hospital setting from a fixed camera position in full 360 VR. So the first step of this study was to validate our teaching resources and ensure they were the best quality. We did this by looking at commonly accessible arthrocentesis videos online and comparing them on multiple criteria, as you can see here in figure 1. Together, the injection video and the VR video together provide a holistic approach to the procedure. One thing I wanted to highlight was that patient communication was something that was very lacking in almost all the videos that were there. However, it was one of the key strengths of our VR video. So a 3-arm study was set up. All students were provided with the lecture video before the workshop. Group A was put into an assessment station, which was an OSCE that did not count toward their grade. Group B were put into a hands-on workshop and then had the assessment. And Group 3 had the virtual reality station, the hands-on workshop, and then the assessment. So it was 25 minutes per station, and then you rotated based on where you started, as per the arrows you can see here. All students ended up getting every teaching method to ensure a quality of teaching. So the immersion room was also incorporated, which I'll show in the next slide. It was used to accommodate more students, but the focus is on the VR rooms, the VR headsets. So here you can see on the left is a student in the VR room, fully 360 immersive experience from a fixed camera position. So as you look left, so does your field of view, or wherever you look. And on the right here, you can see the immersion room, which is like the D'Arenberg Cube. It's a large 360 screen, which played the exact same video, but just as you can see, it accommodated more students. Here you can see the hands-on workshop where students are able to practice the procedure and on those knee models that I mentioned earlier and ask questions if they wanted to. And here you can see the assessment station where students were assessed in OSCE conditions using the OSCE rubric. So after the session, students are handed this survey here. They filled it out by choice. And then to assess the viability of virtual reality, we essentially compared OSCE scores between groups B and C. And then we also looked at student comfortability with the procedure as well. And then, so 100 surveys are filled out over 2 separate days. 33 of them had VR headsets, and we obtained OSCE scores on all the students. So here on figure 2, as you can see, students with virtual reality headsets overall felt more comfortable with doing the procedure. That includes setting up. Overall felt more comfortable doing the procedure by themselves. and also felt that the VR station added more to their skills and understanding if they had the headsets. Here you can see that students with the VR headsets rated the quality of the video lower, which is a limitation of the technology that I'll get into. And then also, but regardless of this, they still rated the educational value of the VR video higher. It was on a 9-point Likert scale, sorry. On figures 4 and 6, you can see that Group C scored significantly higher on the OSCE. You can break this down further into headset and immersion room within Group C, and as you can see, headset scored slightly higher on average. So the limitations, as I was mentioning earlier, biggest limitation was the technology. Students found the VR video to be a little bit, or quite blurry. It was subjective. Some students found it quite blurry, some didn't. And they had audio issues as well. Usually it's due to the fitment issue of the headset to the student's head. That was one of the main limitations, but also students, although we appreciated that fixed camera position and looking around, they thought that the camera angle was too far back and they would like to walk around within the VR video as a full immersive experience. This has been discussed with the Adelaide Health Simulation Laboratory, and it is possible soon, so we can make that video. It's just quite difficult to do so. Another limitation was students with glasses cannot put on VR headsets. It's just a limitation of the technology. You can't see. So whoever volunteered for that had to just get put into the other room. So students that went, so within the assessment station, the OSCE, students went blinded, so they watched their peers conduct the OSCE. So if you're within that OSCE and went within that group and went later within the group, you watched your peers conduct the OSCE and hence scored slightly higher. It was consistent throughout all the groups and impacted the data evenly. So possible extensions of this study include the walking around video, which I mentioned, which is likely the next step of this study. But there's also this technology here, which is Royal College of Surgeons of England certified, and it's being used in UK hospitals. It's a 360 immersive experience like our headsets, however, has these controllers which allow haptic feedback. So you can practice procedures pretty much in a very safe environment. Okay, moving forward. So in conclusion, the key points that I'd like to highlight here, that students who had virtual reality headsets were overall more comfortable with the procedure, more comfortable in doing the procedure by themselves. They scored higher on the OSCE, and the teaching was enjoyed by students who generally wanted more of this sort of teaching. But given our current iteration of the video and the technological issues we had, I don't think that VR is currently a sufficient teaching method by itself. However, it is a great teaching supplement and tool that should be used with conventional learning. This technology has a lot of potential and is likely the future of medical teaching. Thank you. Any questions?
Well done. Questions? Thank you.
Thank you.
Do you think having used the technology yourself, that fact that it's something finding that people have used before that maybe you'll remember the steps a bit better when they refer back to instruction video?
Yeah, I feel like any student and any person learns from their own mistakes, and being able to do the procedure and make mistakes, it'll probably stick with you. And then it's a safe environment, so I feel like I felt personally that it was easier to remember. I don't know if I'm answering the question correctly here, sorry, but I just felt personally that it was a good way to learn the procedure. So can you just rephrase your question so I can answer it properly?
I just thought it was more if it was something fun and interesting,
Yeah.
you'd be more likely to remember the steps because you have a more vivid memory.
Yeah. So that's what I mean. When you're doing it yourself, you're more likely to remember it yourself. And yeah, like you said, it's more fun. So obviously you're going to remember it probably better. Yeah. Thanks.
You mentioned the difficulties of people wearing glasses, and just looking around the audience, what about people wear glasses and hearing aids?
That can be difficult. One thing I did note that was that students who were short-sighted, that was fine. It was just they had quite difficulty seeing, so that was a limitation of technology.
No questions online? No.
Excellent.
Thank you very much. Thank you very much. Thank you.